p.m. on May 5th, 2020. Thank you for joining us. This is Janet Hill at the Rock Island County Health Department. Today we have no prepared statements, but Ed Rivers of the Scott County Health Department and Nita Ludwig of the Rock Island County Health Department are here to answer your questions. As always, we ask that you put who you are addressing in the chat for your question in the chat box, and Brooke Barnes of the Scott County Health Department will moderate the questions. Nita, go ahead and start us off with the Rock Island County case count.
Sure. Today we are reporting 25 new COVID-19 cases, and that brings our total for Rock Island County to 516. 23 of the cases are currently hospitalized locally on the Rock Island County side of the river, and we still remain at 14 total deaths for Rock Island County, and that's today's numbers.
In Scott County, EPH reported another 10 cases, which puts our total at 255. With 2,926 tests, that's about 8.7% positive, and our deaths remain at 7.
Okay, we're now going to go to questions that have been submitted. We did receive one ahead of time, so we'll go with that first, and please type any additional questions that you have there into the chat. First question is for Ed. Do you know how many contact tracers the Scott County Health Department is using, and are these regular staff, or have you called up volunteers such as from the Medical Reserve Corps?
Well, we haven't used the Medical Reserve Corps. Our department's currently able to meet the COVID-19 positive case follow-up needs by using our staff. In addition to 13 clinical staff members, we have 4 staff from other service areas who've been trained in COVID-19 case follow-up. Our Department of Public Health has been diligent in providing COVID-19 specific guidance on case follow-up to local health departments. And while COVID-19 is a new illness, communicable disease follow-up and its principles are a foundational activity of public health.
Thank you, Ed. Next question, Nita, can you just verify the total number? Was it 516 or 515?
It is 516 today.
516. Okay, thank you. Next question is also for Nita. Would you please give us an update about the number of Tyson cases?
Sure. So the number of confirmed cases at the Tyson plant in Joslyn is 97 for Rock Island County.
Okay, if you have any additional questions for Ed or Nita on the public health response or any current information, please type those in. There's a partial question there. I'm going to wait for the full thing to come through, so we're going to give it 1 second here. Okay, we'll wait for WVIK to have the additional piece there. Ed, question for you. Does Iowa plan to report the number of positive tests down to the zip code in the near future? Sorry about that. Ed, you're on mute. Can you unmute yourself? Thank you.
Yeah, sure. I don't know that IDPH is going to report below the county level, but if they do make that change, you'll be able to find it at the website coronavirus.iowa.gov.
Okay, thank you. We're going to go back to that additional question. This one was, do the people who die from COVID-19 who live in nursing homes go to the hospital for treatment? Is there any information you can provide on that for Rock Island County, Nita?
I don't know that I have any hard information for that, but we do know some of them have been hospitalized and some haven't. That's really the best information I have right now.
Ed, any information you're able to share for Scott County?
I'm sorry, I didn't hear the question. Now I'm not hearing you.
My fault this time, sorry about that. For those individuals who are in nursing homes who have passed away from COVID-19, have they been hospitalized? Is there any information you're able to release on that?
I don't have that information available to me at the moment. And we've said before that when it comes to individual cases, that is information that we cannot release. The information provided by Iowa Department of Public Health is at the county level, and only under very escalated circumstances would they release information below that level.
Thank you. Again, we have a question about modeling that's done. Can both of you speak about the modeling done by the University of Washington? Ed, do you want to start with that, please?
I'm not sure I understand what the question's asking for. We talked yesterday that IHME had put our peak in Iowa at May 4th, I think it was, for deaths, and back at the end of April for hospital resource use. Beyond that, I'm not sure I understand what they're asking.
Okay. Nita, would you like to respond to that just about, I'm assuming it's the modeling related to case numbers, peaks, that kind of thing?
Right, I did just look at it just a few minutes ago when the governor was talking as well, and it looks like they had added some different forecasts to their models, and it looks like the curve is going to last longer than had been predicted earlier for Illinois. But I haven't really studied them yet. No, I haven't.
Thank you. The next question that we have, we did receive earlier today, so I'll just share that same response. Can Scott County please confirm cases related to the Tyson-Jocelyn plant outbreak? And the Iowa Department of Public Health, as we've mentioned, has been the entity that determines whether or not information can be shared regarding businesses. And they have determined that they're only sharing those based on those that have reached outbreak levels in the state. So that's the only information that's able to be shared from our department based on the guidance we're provided by the state. An additional question, how is the infection handled in long-term care facilities? Nita, would you like to start with that for Rock Island County?
Sure. Well, I think it's handled the same no matter where you are, since we really don't have medication or a vaccination for that. The key is really to clean and disinfect and to make sure that they're all wearing proper PPE, the protective equipment, when dealing with the residents and isolating them if they are sick from those who are not sick, and really doing all the same things like we ask every person to do, and that is frequent hand washing, staying 6 feet away when it's possible, having a face covering, and, you know, again, just the same things, not working when you're sick, all those same sorts of things that we've been instructing everybody to do for the last few weeks.
Do you have anything you want to add that might be unique to Scott County for long-term care facilities and the support that's provided there?
We're working closely with the long-term care facilities to provide, for example, PPE when it's needed. And there is guidance from the Iowa Department of Public Health for long-term care facilities and how to properly manage cases and make facilities safe for their clients.
The next question was for Ed on the Columbus Junction Tyson plant outbreak, which has been identified by the Iowa Department of Public Health. We're going to come back to that. We're gathering some information on that for you at this moment. To the next question, it looks like just providing some information on the University of Washington predicting a peak. It says for June 8th for Iowa, so you can see that there in the chat. Ed, perhaps you could refresh our memory for this next question. Why is Iowa not willing to report below the county level?
Iowa Department of Public Health is very fastidious about not providing information that could possibly lead to a single case or a person being identified. And for this particular instance, the county level is the level they've chosen. If the numbers become large enough in counties or particular counties, they may break it down to zip code, but they have not done so up to this point.
Okay, please type any additional questions into the chat for us. We did just receive some information from one of our staff here about the Columbus Junction Tyson plant. We believe there may be less than 10 cases that have been of Scott County residents that are tied back to that. So that's the information we're able to provide at this point based on the timing of your question and where we are able to gather some information. So please, if there's any additional questions, we'll go to those. If not, we'll look at concluding for today and then providing more information later this week. Okay, no extra questions. Thank you again, Ed and Nita, for your answers provided today, and we look forward to talking with everyone in the upcoming days. Have a good day.